Good afternoon, clinical bacte students. So for today, I will be discussing the rest of the topics of your aerobic gram-positive bacilli. Okay, so unahin lang natin si Corynebacterium species. Your Corynebacterium species, they are said to be non-motile organisms, non-spore forming also, and then they are also non-encapsulated. Okay, and then these are gram-positive pleomorphic bacilli. Again, when we say pleomorphic, anong ibig sabihin ng pleomorphic? Let's say they do not have a definite arrangement. Okay? So, pag sinilip mo yan under the microscope, medyo magulo yung kanilang itsura. Okay? Then, aside from this one, your Corynebacterium species, they are also catalase positive and oxidase positive. Now, your Corynebacterium species, generally, they are pathogen of animals and human also. However, some species are found as a normal flora of the skin and the intestine, just like your Corynebacterium diphtheroids. Okay, so, yung Corynebacterium diphtheroids natin, part siya actually ng normal flora, especially the skin. And then, what else for your normal flora? Your Corynebacterium cirrhosis also. Your Corynebacterium cirrhosis, makikita yan sa skin, especially yung malapit sa mata. And then what else for your Corynebacterium species? Your Corynebacterium bacteria, they are said to be free-living saprophytes. Free-living saprophytes, and then some are considered as plant pathogens. Now, these species, they are said to be closely related to related to Mycobacteria and Nocardia species because of their cell wall. Okay, so medyo may similarity sila when it comes to their cell wall. Kasi bakit? Ano bang meron sa kanilang cell wall? Your Corynebacterium species, they actually have their, what you call this, your mesodiaminopimelic acid that is found in their cell wall, as well as mycolic acid. Okay? Kung matatandaan nyo yung mycolic acid natin, makikita din yan sa cell wall ng ating mga acid-fast bacteria, just like your Mycobacteria and your partially acid-fast bacteria, your Nocardia. Now, aside from this one, your Corynebacterium species, they are also considered as glucose fermenters. They are said to be glucose fermenters and maltose fermenters, except for your Corynebacterium urea liticum. Okay? So, si Corynebacterium urea liticum, hindi siya carbohydrate fermenter. Now, let us discuss first your Corynebacterium diphtheriae. Your Corynebacterium diphtheriae, also known as your club loefflers bacillus, these are aerobic or sometimes facultative anaerobes yung mga yan. Okay, aerobic pleomorphic rods, but take note class, they grow best under aerobic conditions. Again, uulitin ko, they are aerobic pleomorphic rod organisms, but some are considered as facultative anaerobe, but lagi niyong tatandaan that they grow best under aerobic conditions. Now, your Corynebacterium diphtheriae, they usually inhabit the human nasopharynx, but only in carrier state. Okay, yung mga carrier host lang natin. And then, always remember also class that your Corynebacterium diphtheriae, they will never be part, again, they will never be part of the normal flora of the respiratory tract. Okay, so always pathogenic yan sa human, especially kapag nasa respiratory tract yan. Now, how will you acquire this type of infection? Okay, your Corynebacterium diphtheriae, they can be acquired by droplet nuclei from the respiratory tract, or they can be transmitted through direct contact. Okay, direct contact with infected cutaneous lesion. Okay, so dalawa ang transmission natin. Pwede siyang ma-inhale by close contact, or pwede siyang ma-acquire through direct contact sa infected lesions. Now, your Corynebacterium diphtheriae, again, they are they are glucose and maltose fermenter. So, biochemically, they will produce acid. Okay? So, acid producer yung mga yan. But, when it comes to TSIA, hindi sila magpuproduce ng gas. Okay? Again, ulitin ko. They produce acid because they are capable of fermenting your glucose and maltose, but they are not necessarily will produce gas. Lalo na sa TSIA natin. Okay? And then, your Corynebacterium diphtheriae, they are also catalase positive, but urease negative. So, biochemically, they are catalase positive and urease negative. And then, they are also capable of reducing nitrate to nitrite. Okay, so, nitrate reducers yung mga yan. Now, in your Corynebacterium diphtheriae class, for the isolation of this organism, it is very important that the enrichment of the medium with, example, yung mga serum natin, serum, sulat ko, serum, cysteine, and potassium tellurite. All of these supplements, they are very important as, ano bang tawag dito? Kailangan tawag dito, you have to add this one sa culture media natin for the enhancement of the growth of this organism. Okay, so kailangan nila ng serum, na cysteine, as well as potassium tellurite. Okay, now take note class that your Corynebacterium diphtheriae, they are also very resistant. Take note, they are very resistant to drying, and then they are also capable of remaining viable in the environment for weeks. Now, the main virulence factor of this organism is their exotoxin also. You call it your diphtheria toxin. Now, this diphtheria toxin is capable of producing, tanggalin ko lang to. Okay, your diphtheria toxin is capable of causing tissue necrosis as well as exudate formation. Diphtheria toxin is capable of forming tissue necrosis as well as exudate formations. Now, infections caused by this bacteria is called diphtheria. We call it diphtheria. Diphtheria class is an acute contagious disease characterized by the production of this systemic toxin, which is your diphtheria toxin. Now, this diphtheria toxin, they are being secreted by the bacteria that causes tissue necrosis and exudate formation. Then later on, yung diphtheria toxin na yan, okay, it will now produce or cause the formation of pseudomembrane formations, okay, or pseudomembranous formation of the mucous membrane and the throat, leading to respiratory obstruction. Okay, so yun yung pinaka main pathophysiology ng diphtheria natin. These pseudomembrane formations are caused by this diphtheria toxin. Now, yung pseudomembranes na yan na mamumuo dun sa respiratory tract, later on, it will cause obstruction. Now, there are two forms of diphtheria. Okay, number one, we have the respiratory form and then the cutaneous form of diphtheria. Unahin lang natin si respiratory class. Respiratory form of diphtheria, it is actually a form of pharyngitis characterized by the development of an exudate membrane that covers the tonsils, the uvula, the palate, and even the pharyngeal wall. Now, this form of diphtheria, it could actually lead to exudate formation. Okay, asa na yun? It could actually lead to exudate formation and tissue necrosis, resulting to a gray to white pseudomembranous formation, or simply pseudomembranes. Okay, again, ulitin ko, this form of diphtheria, it could actually lead to exudate formation and tissue necrosis, resulting to gray to white pseudomembranes. Okay, now this type of diphtheria, your respiratory diphtheria, it can be acquired through contaminated droplets or hand-to-mouth contact. Now, However, class, in this type of diphtheria, itong respiratory type ng diphtheria natin, makukuha lang siya sa mga crowded places. Okay, so it can only affect people living in crowded places. Now, the signs and symptoms of this one, it includes low-grade fever. Okay, sulat natin. Low-grade fever with characterized with thick, mucopurulent nasal discharge. Now, this form of diphtheria, it could actually lead to death secondary to cardiac failure. And then, we have your cutaneous form of diphtheria. Your cutaneous form of diphtheria, also known as your velat sore, or the barkurat, okay. This form of diphtheria naman, class, it is characterized by slow healing ulcers. Okay? Slow healing ulcers. It is characterized by slow healing ulcers as well as membrane formations also. Now, the toxin, your diphtheria toxin, it is systematically absorbed but complication is less common naman. Now, this type of, let's say, your sore or yung barkurat na tinatawag natin, it is characterized by crusted. Sulat natin. It is characterized by crusted impetigus skin sores. Okay, again, it is characterized by crusted impetigus skin sores and it occurs in association with heat, in association with dirt, and even minor traumas and diet. Lalo na yung mga lack of diet in vegetable, sila daw yung usually prone to develop this type of diphtheria. Now, let us go over with the laboratory diagnosis of your Corynebacterium diphtheriae. Now, for the specimen collection, our specimen of choice would be the nasopharyngeal swab as well as the throat swab. Okay, so yan yung mga specimen of choice natin. Now, always remember, class, take note na pagdating sa specimen collection, calcium alginate swabs, okay, this type of swab, they are most preferred when it comes to specimen collection, your calcium alginate swab. And then, for the gram stain appearance of this bacteria, again, they are gram-positive cells, okay, gram-positive rad, slightly curved yung mga yan, and then they are arranged in palisades, okay, they are arranged in palisades, or in pairs, forming, sometimes magfo-form sila ng X, V, Y, sometimes L. Ganyan ang itsura nila under the microscope. Okay, this, they form this kind of formations resembling now the Chinese letter appearance, or sometimes we describe it as picket fence appearance. Okay? Now, their arrangement, class, yung arrangement ng ating Corynebacterium diphtheriae, okay, it is due to incomplete. It is due to incomplete fission initially during multiplication. Okay, so actually, dahil pala yan sa kanilang incomplete fission initially during their multiplication. Now, this type, these organisms, class, they may also occur in club shape. Okay, club-shaped swellings and beaded forms. Sometimes, ganyan ang kanilang itsura. Okay. So, ayan. So, under the microscope, ganyan ang makikita nyo. Gram-positive rod arranged in palisades. Sometimes, magulo yung kanilang formation, resembling now the Chinese letter appearance. Now, again, what do you call this? What do you call their, ano ba yan? Sorry. What do you call this structure na makikita mo kay Corynebacterium diphtheriae? We refer to it as their food inclusions. What do you call that inclusions? Their metachromatic granules, also known as the Babes Earns granules. Tanggalin lang natin to. Okay. Their Babes Earns granules. Kaya nga class, for example, in the future, kung may ma-encounter man kayong ganitong uri ng organism, let's say your Corynebacterium diphtheriae, pag sinilip natin yan under the microscope, tapos medyo magulo yung kanilang itsura, tapos may mga inclusion sa loob, okay, may mga inclusion sila sa loob, pwede nating i-assume yan na Corynebacterium yan. But sometimes, yung ibang students kasi, akala nila, yung ganitong nasa loob ng cells ng ating bacteria, it is the endospore. Okay? Again, ulitin natin, balikan natin yung ating Bacillus species. Anong sinabi natin sa itsura ng spore? Diba? They are unstained. Hindi mo may stain basta-basta ang endospore. Okay? Sometimes we describe it as empty spaces or empty spaces or clear area. But this time, pag nakakita kayo ng mga ganyan, dark inclusions, it is actually representative of their granules. Okay? Now, in this case, in your Corynebacterium diphtheriae, we call it your Babes Earns granules. Now, these metachromatic granules class, they can be demonstrated by using special stains. Okay? So, pwede natin silang gamitan ng special stains. Okay? So, for example, we have your Loeffler's alkaline methylene blue, your Loeffler's alkaline methylene blue stain. We also have your Neisser's stain, your Albert's. We also have your Lubinsky. So, ayan, 4 lang pala yung ating special stain to stain these metachromatic granules. Okay, so we have your Loeffler's alkaline methylene blue, your Neisser's, Albert's, and Lubinsky. Now, when isolating Corynebacterium organisms class, it is very important to remember that they require amino acid for their growth. Okay, now for lipophilic coryneiforms, their broth are added with rabbit serum to enhance their growth. Again, ulitin ko, yung other coryneiforms natin, yung mga other Corynebacteria, pag i-culture mo yan sa broth natin, let's say nutrient broth, it is important to add it with, ang tawag dito, rabbit serum. Kailangan dagdagan ng rabbit serum to enhance their growth. And then, generally, lahat ng Corynebacterium organisms, they require amino acids for their growth. Okay? May kulang pala, your lipophilic coryneiforms. Lipophilic coryneiforms, kailangan nila ng rabbit serum added into the nutrient broth to enhance their growth. Okay? Now, for the culture media, for the cultural characteristic of this bacteria, ano-ano yung mga culture media na pwede natin gamitin in order to isolate this organism. So, number 1, pwede tayong gumamit ng blood agar plate. Chocolate agar plate also will do. We have your CTBA, which is a selective agar for the isolation of your Corynebacteria. We can also make use of the Tinsdale agar and then your Loeffler's serum agar. Now, in blood agar plate class, ang itsura ng kanilang colonies are, these are small granular colonies. Small granular colonies with irregular edges, and then they may have a small zone of hemolysis. Small zone of hemolysis. And then, when it comes to primary inoculation of throat swab, let's say, mga throat swab, to a Loeffler's agar, or sometimes we refer it to Loeffler's slant kasi. Okay, Loeffler slant. Okay, again, primary inoculation of throat swab in this agar before subculturing it to CTBA, they may improve the recovery of Corynebacterium diphtheriae. Again, isimplify natin class. Pag magpa-primary inoculation ka daw sa agar na ito before you subculture it to your CTBA, this is said to be will improve the recovery. Okay, it will improve the recovery of your organism, which is your Corynebacterium diphtheriae. So to cut it short, ang primary inoculation muna natin should be in this agar. Okay. Now for your CTBA, your cysteine tellurite blood agar, okay, it is said to be a selective and differential media. It is preferred for the identification of your diphtheria. Now this agar class, it contains sheep's blood agar as well as bovine serum, cysteine, and potassium tellurite. Now, ang itsura ng colonies natin in your CTBA, it is black-brown colonies. Okay? Black to brown colonies. Or simply black-brown colonies with brown halos. Okay? Now, bakit nagkakaroon ng ganyang color yung ating colonies? These brown to black colonies are due to the reduction of this potassium tellurite na present sa ating agar. It is mainly due to the reduction of this potassium tellurite. Now, in your CTBA class, okay, alisin lang natin to. In your CTBA, we have actually different types of colonies kasi. Okay, we have actually 3 types of colonies na makikita sa CTBA. Number one, we have your metis, type of colony. We also have your intermedius, and then your gravis. Again, your metis, your intermedius, and your gravis. Now, these are the 3 types of colonies na may encounter natin sa CTBA. We have your metis, your intermedius, and your gravis. Now, each of which, they have different appearance and then they have different characteristic of their colonies. Yung metis natin, they have very small black colonies. Very small black, sometimes convex. We describe it as convex. Colonies resembling a fried egg. Okay? Resembling a fried egg appearance of colonies. And then, aside from this, they have this bleach-like odor. Bleach-like odor of the colonies. And then, for the intermedius type of colony class, they are said to be small, flat, and dry colonies. Okay? Sometimes grayish to black yung kanyang color ng colonies natin. And then they have this shiny surface of the colonies resembling now a frog's egg appearance. Okay? Kasi shiny yung surface ng colonies ng intermedius. And then for the gravis class, they are said to be grayish, black, and opaque colonies. Okay? Grayish, black, opaque colonies. Resembling now a, tawag dito, resembling like a daisy head colonies. Okay? And then when it comes to their hemolysis class, your intermedius and your gravis colonies, they are said to be non-hemolytic. Okay? So, gamma hemolytic. Non-hemolytic. And then for your metis naman, they are said to be hemolytic. Now, sa another type of culture media that we can make use of isolating your Corynebacterium, we have your Tinsdale agar. This agar class, it is composed of sheep's blood, bovine serum. Okay, sulat natin, sheep's blood. Okay, ano pa? Bovine serum. Okay. bovine serum, cysteine, potassium tellurite, and sodium thiosulfate. Okay, again, we have your sheep's blood, okay, bovine serum, cysteine, potassium tellurite, and sodium thiosulfate. Now, your Corynebacterium diphtheriae will grow in this agar media, exhibiting now a black colonies with brown halo. So, just like your cysteine tellurite blood agar. Okay? And then we have your Loeffler's serum agar. It is also known as your pies slant agar. Now, para saan naman ito, class? It is very useful for observing microscopic, take note, microscopic morphology of your isolate as well as their metachromatic granules. Okay? So, your Loeffler's agar, class, it is very useful to observe the microscopic morphology and as well as the metachromatic granules of your Corynebacterium bacteria. Now, they have this characteristic appearance of their colony resembling now like a poached egg appearance. Okay? Now, for the diagnostic test of your Corynebacterium or simply your diphtheria infection, we can make use of this what we call Schick test. Your Schick test is actually a skin test. Skin test yan, class, for Corynebacterium diphtheriae used to determine whether or not a person is susceptible to diphtheria. Okay, so actually, susceptibility test din yan for your Corynebacterium diphtheriae. Again, ang positive result lang yan is the presence of redness or erythema dun sa site kung saan na-inject yung toxin. Usually, within 2 to 4 days, lalabas yung result natin. Okay? And then, aside from this one, we have this several types of toxigenicity test. Number 1, we have your guinea pig lethality test. Okay? Wait lang, ayusin lang natin. So, these are now your toxigenicity test. Okay, so, number 1, we have your guinea pig lethality test. And then, we have your tissue culture test. And then, nowadays, may mga available na rin na serological test, just like your ELIC test, and then your PCR, of course. Okay, now these two, class, your guinea pig lethality test and then your tissue culture test, these are in vivo. Mga in vivo testing yung mga yan. And then for your ELIC test, also known as your, actually your ELIC test is based from immunodiffusion. Ang principle niyan is immunodiffusion. Now, these two, your ELIC test and your PCR, these are in vitro serological test. Now, let us move on to your other coryneiforms bacteria. Okay, so number 1, we have your Corynebacterium pseudo-diphtheriticum. Your Corynebacterium pseudo-diphtheriticum, also known as your Hoffman's bacillus, it is actually a normal flora of the nasopharynx. Okay? However, this bacteria, class, it can actually cause opportunistic infections like respiratory tract infection, UTI, and even wound infections. Although, itong mga opportunistic infections na ito, usually, nangyayari lang yan, especially sa mga immunocompromised patients. Okay? Now, this bacteria, class, biochemically, they are also nitrate producers, or let's say nitrate reducers, and what else? Positive for urease. Okay? Again, they are nitrate reducers, as well as they are positive in urease. And then we have your Corynebacterium jacqueum. These bacteria naman class, they proliferate as skin flora among hospitalized individuals. Okay? Now, they are considered as resistant to multiple antibiotics due to the presence of their beta-lactamase. Okay? Now, they are the most common cause of diphtheroid. Okay, sulat natin, diphtheroid prosthetic valve endocarditis. Okay, again, your Corynebacterium jkm, they are the most common cause of diphtheroid prosthetic valve endocarditis. Okay, so pag tinanong ko class, ano ang most common causative agent of prosthetic valve endocarditis associated with diphtheria organisms, or let's say diphtheroid, ganyan. Okay, ang una natin agad may isip is Corynebacterium jkm. Now, this bacteria class, they grow as large colonies on blood agar plate, supplemented with 1% twin AT. Okay? And then next, we have your Corynebacterium ulcerans. This bacteria naman class, they are associated with diphtheria-like sore throat. Diphtheria-like sore throat. Now, actually, although this bacteria naman class, they are mas common yan as animal pathogen. Okay, so they are considered as animal pathogen causing now mastitis. Mastitis especially among the cattle. Okay, mastitis. And then lastly, we have your Corynebacterium urealyticum. This bacteria naman class, they are a causative agent of UTI and wound infections, especially among the immunocompromised patients. Okay? They are also resistant to multiple antibiotic, and then they are also urease positive. Urease